start with the latter. The fastest growing disease among teenagers in our county today, including diseases that we treat in our county health clinics, the nearly 100 clinics we have throughout the region, is type 2 diabetes, what used to be called adult onset diabetes, because people got diabetes when they were type 2 diabetes when they were adults, like I did. When I was about 51, I was diagnosed with type 2 diabetes, but now we're seeing 12, 13, 11-year-olds being diagnosed with this disease. The reason for it is partially genetics, partially lack of exercise, and largely their diet. And you can walk onto any high school or junior high school campus in this town, even elementary schools, and see the obesity problem right before your eyes. The percentage of kids who are obese today are far greater than I can ever recall. I don't know what the actual statistics are, but anecdotally, I've been walking the campuses for my entire adult life, and you can see it with your own eyes just walking the campuses. The lack of exercise and the lack of good diet, the lack of proper eating is contributing to the diabetes epidemic, which has profound financial and social implications for our society for years to come. A kid who is diagnosed with diabetes today, contracts diabetes today, type 2, is likely to be on dialysis by the time he or she is in their mid-30s, and face all the vicissitudes of that disease that people who don't get treated for it, don't manage it, face historically have faced when they're in their 60s and 70s. The cost of treating this disease for young people is astronomical and will have profound implications for our health budgets and for our overall public investment in health care for something that is totally avoidable and totally manageable through diet and exercise. So this whole food movement, healthy food movement, is not just some elitist do-gooder kind of thing. It has profound positive implications, tremendous potential for helping us avoid costly diseases in our society, both financially costly and from a health point of view costly, because the quality of life of the people who I'm talking about, their quality of life will be significantly diminished, their productivity will be significantly diminished. It's a lose-lose situation. In the County of LA, we have taken some pretty aggressive and radical steps. We don't get a lot of attention for it, but we have totally required in all of our county facilities, including most of our jails, healthy foods. We have endorsed and helped school districts throughout the county using our public health department to move out the unhealthy foods from the vending machines and bring in healthy foods, get rid of the sugar and the candy bars and those kinds of things, and bring in healthy food that kids can learn to eat, and just like candy bars are habit-forming, juicy apples can be habit-forming too, and educate them, educate the kids, the teachers, the parents as to what the stakes are. I tell you that the biggest challenge we have is informing and educating people about this. And if we're talking about kids today, you'll be focusing a lot of your attention about kids. You got to get to the parents too. And this is a sensitive issue, and it's a delicate issue. Back to diabetes, the three communities that are most prone to diabetes in our society are people of Eastern European descent, African Americans, and Latinos. Those are the three that have a genetic predisposition to this disease. Well, go to a Jewish mother and tell her that you can't have chicken soup on Friday night, and you're crossing the line. Go to a Latino family and say tortillas are off the menu, or carbohydrates in general are off the menu, is a cultural affront, and the same in the African American community. So it's a sensitive issue. It's got to be addressed carefully, but it has to be addressed, because if the cooks in the household don't get it, The kids won't get it. The downward spiral, this vortex that's sucking the health out of so many of our people, will continue to grow in force. So education, information, talks like this, I go all over my own supervisorial district, which is 2 million people, so I represent the whole west side, the whole San Fernando Valley. And I go to schools, I go to community groups, and I just talk turkey to them about this, and I talk it from a personal point of view. Because when I got diagnosed with diabetes, I had to change my whole diet. It was either that, or as my doctor said, you go blind, have amputation, 3 other maladies. I said, with my luck, I'll get 3 out of 5. And so I changed everything. I stopped eating sweets, I stopped eating ice cream, which was a big sacrifice for me. I got rid of all white food, basically, white bread, white rice, to try to reduce the level of carbohydrates that I was taking in, because carbohydrates, when you ingest them, turn into sugar instantly and drive your blood sugar up. I got educated in this after I got diagnosed. I wish somebody had taken me by the carotid artery and told me about this 20 years earlier, because my mother had diabetes, and diabetes is run in my family, but somehow I paid no attention to the genetic probabilities that I had. We've got to grab society by the neck and wake them up to what the stakes are here. And that's what this conference is all about. That's why I wanted to be here today. Number one, thank you for being here. Thank the organizers for putting this together. You will reach a lot of people. As I was walking in, I met 2 teachers from local high schools. They're bringing students here with them. This is what needs to be done, and it needs to be an ongoing, intensive educational campaign. Once you get the education connection, the other stuff will flow. And being in a good food mentality and being part of the good food movement is it's actually fun. It can be a challenge in the best way, but you gotta have motivation, right, to get people to change. And the motivation is health. So the connection between good food and health is 100%. There's 100% nexus there, period, over and out. So I salute you for being here. I want to encourage you to do at the grassroots what needs to be done. Continue to inform us in the public policy arena. And if you have good ideas, send them my way, send them to your elected officials' way, because ideas are not a dime a dozen, or ideas may be a dime a dozen, but good ideas are worth a lot more than that. And some of the best ideas we've had have come from people like you. So we're making, there's been in the last few years, been tremendous progress made in this arena at the public policy level. We've had to take on big food manufacturers, beverage companies, and candy companies, and I spoke to several years ago to the people at Coca-Cola here, and of course they have a big plant here in Los Angeles. And I said, you guys should find a way to make a healthy drink that will sell just as well on the school campuses as the junk drinks that you have. You can do it. You've got the wherewithal, you've got the resources, both intellectual and financial, to do it. You can make money with healthy food. You don't have to make money ruining people's health. And that's the message to the business side that we've been trying to communicate. And I think slowly but surely, not because they want to, but because they're being forced to, they're starting to look at those options. Because over time, given the statistics that I cited earlier, given the direction society is going in terms of the health impacts and health costs from junk food, and junk food isn't just hamburgers; it's all of the junk that we ingest. That it's inevitable that society will at some point turn on the bad food and focus on the good food. And you have to be that constituency in the process. If you just get one kid in one school to change his or her diet, you will have done a great good deed for that kid and for society. And if each and every one of us, every teacher in the schools can reach 1 or 2 or 5 kids who are headed towards obesity and disease, and put them on the straight and narrow, it will be a great need. And the last thing I want to say is eating healthy also means you feel better. And somehow we've got to get young kids, and it's hard because young kids think they're going to live forever, to just give it a shot, give it a try, and see how they feel after they've eaten properly and eaten healthy compared to when they didn't. They're not as tired, they're not as reluctant to exercise. I mean, good health, good food feeds good health, and good health feeds on itself, so that people will have more energy to do what needs to be done to keep themselves healthy once they get on the right path. That's what I found when I changed my diet. I've been a jogger really since high school, and that's my form of exercise. I ran track in high school, and when I graduated high school, I stopped running track, and I parked up very quickly, and so I got back to running. But I never really enjoyed running as much as when I started to significantly change my eating habits, because I had more energy, I had more stamina, I could run longer and faster, which caused me to lose more weight, and it just was I was on a roll. And those are the kinds of things that through experience, I think we can make a difference in kids and adults' lives as well. So thank you for being here. Thanks for inviting me to give you a few opening remarks. You have an outstanding panel. I'm sorry I can't stay. I've got to be downtown at 11 o'clock, and it took me an hour and 14 minutes to get here from the Fairfax district, so God knows how long it'll take me to get to downtown. But good luck to you. Have a great conference. And pardon? Expo, and go for the Expo line. We just broke ground on it Monday, so it's coming. It's coming right here. So, all right, take care. Thank you very much.
Supervisor Yaroslavsky, and it's so important to get public policy and our public officials involved in the debate and the discussion, and perfect model of somebody who has walking the walk and talk the talk and living proof. You look fabulous. All right, now I'm going to introduce the rest of our panelists. This is a very outstanding panel. I think we have to be mindful of the time. I think we need to stop at 10 sharp. I believe is our time frame. With no further ado, I'll start at the far end and work back this way here. Starting with Bob Martin. Sorry. He is with the Pew Environmental Group. I just want to read you the Pew Environmental Group's mission statement. We work globally to establish pragmatic, science-based policies that protect our oceans, preserve our wildlands, and promote clean energy economy. Bob Martin joined the Pew Environmental Group in 2009 after having worked with the Pew Environmental Group for many years, with the Pew Trust Group for many years, as a senior officer working to reduce health issues related to poor conditions on industrial farms, including the preemptive use of antibiotics. And that's what he will be speaking about today. Prior to this, he was the executive director of the Pew Commission on Industrial Farm Animal Production, leading its 2-year study, which was funded by Pew through a grant through the Johns Hopkins Bloomberg School of Public Health. He has worked for United States senators, and he began his career as a general assignment reporter in Pennsylvania, and he worked later on in the Kansas Farmers Union. So welcome to you, Bob. Next we have Andrea Azuma. She's with Kaiser Permanente, and Andrea is a project manager in community benefits for Kaiser Permanente, Southern California region. She works primarily on healthy eating, active living, HEAL, Kaiser Permanente's comprehensive approach to reduce and prevent obesity in communities. She has experience in both urban and rural settings to improve food access opportunities and is skilled at working collaboratively using participatory research methods. Andrea received a bachelor's degree from Occidental College and a master's degree in nutritional sciences from Cornell University. Ken Kaplan is a champion for changing the food system to improve health and the environment. His recent design research at MIT emphasized the integral link between food and health and introduced him to a range of organizations involved with both. He is committed to encouraging collaboration between programs that advocate sustainable food production and programs that provide healthcare services with the goal of reducing chronic disease and health care costs. Ken has professorships at the architecture schools of Columbia University and Harvard University. He's lectured in the U.S., Europe, and Asia. His work has been featured in the New York Times, The Economist, the Harvard Business Review, the Boston Globe, Healthcare Information, and MIT Technology Review, to name a very few. Nona Evans is at Whole Kids Foundation, President and Executive Director. After nearly 2 decades in retail design, operations, and marketing, Nona is putting the core principles of experiential branding to work as the leader of the Whole Kids Foundation. It's the newest philanthropic endeavor of the Whole Foods market. Nona has a deep passion for improving children's lives through education, as the supervisor was just talking about. She's been a longtime champion for Marathon Kids, a free national running-walking program for children in K through 5 grades, and has been involved in numerous programs designed to support teachers and students. And Mud Baron is well known to people around the Los Angeles area. His new title, as he calls himself now, he is the farmer for the Los Angeles Unified School District. At the San Pedro Science Center, he has established a 4-acre urban farm where he grows seeds, starts, and plants for school gardens for all Los Angeles Unified Schools, all 2,000 campuses, serving all 700,000 students. Each school has a school garden, and each school has a school garden teacher, and what Mudd also does is he teaches teachers how to teach kids how to garden. And so we will be talking to all of these panelists now, and starting with each one of them, they'll each give you a brief overview of their organization and what they can tell us about their organization is doing for the good food movement. So again, back to Bob down at the end. Do you want to tell us briefly about your organization and what you're doing for the good food movement?
Certainly. Thank you to Jim and Laura for having me here today on this great panel. I appreciate it very much. I'm based in Washington, D.C., so any chance to get out away from D.C. is a good thing. As Laura said, I ran the Pew Commission on Industrial Farm Animal Production, which was a 2.5-year study to come up with recommendations to solve the problems in industrial farm animal production in the areas of public health, the environment, animal welfare, and rural communities. The commission had 15 members from all disciplines around the country. The chairman of the commission was former Kansas Governor John Carlin, and he'd been archivist of the United States and started his life as a dairy farmer in Kansas. But we also had 2 members from California you may know of. One is Fidel Bacio, the chairman and CEO of Bon Appetit Management Company in Palo Alto. And then Bill Nyman, the founder of Nyman Ranches in Bolinas. He now heads a group called BN Brand. We also had other production agriculture people in addition to Bill. We had public health experts, we had ethicists, and we had experts in state and local government. We traveled around the country, had 11 meetings over the 2-year period, reviewed a couple hundred separate peer-reviewed reports, commissioned 8 technical reports of our own, and we issued 24 recommendations, consensus recommendations, in response to our charge from Pew at Johns Hopkins. We generally found that the industrial farm animal production system in the United States represents an unacceptable level of threat to public health, an unacceptable level of damage to the environment, is harmful to the animals housed in the most restrictive production systems, and in the long term is a detriment to rural communities where they're housed, an economic detriment in comparison to the diversified family farm system. Our number one public health concern was the routine low-level use of antibiotics in food animal production. I don't know if you know it or not, but the government recently, the FDA recently released information that said 80% of the antibiotics used in the country are given in daily low-level doses to animals, otherwise healthy animals, in industrial farm animal systems to compensate for the overcrowding and poor waste management and to promote growth. Why that's important is antibiotics are considered a community drug. How they're used in human and animal medicine impacts everybody, whether you consume meat or not, because if they're misused, as they are in industrial farm animal production systems, they actually are a major generator of antibiotic-resistant bacteria. Recently, you may be aware that Cargill had to recall 36 million pounds of ground turkey that was tainted with antibiotic-resistant salmonella. It's the largest ground turkey recall in the nation's history, and it's the third largest meat recall. And what they found was that it sickened over 100 people nationally, and I think 3 or 4 people died from the resistant salmonella. And what they found was it was resistant to 3 primary antibiotics used for treating salmonella infections, which salmonella is a fairly common bacteria in poultry, but it was resistant to the major antibiotics used to treat salmonella because they were used in low-level doses to produce the turkeys in the industrial system. The country has a monitoring system for antimicrobial resistance. It's called the National Antibiotic Resistant Monitoring System, or NARMS. It's run, it's a 3-agency overview effort by USDA, FDA, and the CDC. And in 2002, the NARMS system found that about 18% of the infections caused by bacteria were antibiotic resistant, multi-drug antibiotic resistant. In 2009, that's up to, or I'm sorry, 2007, that's up to 60% of the infections are resistant to 1 or more antibiotics. And so what that says is the routine use of antibiotics in animal production is causing them to be less effective. So Pew, with the release of our report, Pew decided to establish an effort to try to convince the Congress and FDA to reduce the amount of antibiotics used in food animal production. It's called the Human Health and Industrial Farming Campaign. It's a joint effort of the Pew Environment Group, where I'm a senior officer, and the Pew Health Group. Pew, I probably should have said a little bit about Pew generally before I get started, but Pew is a very large non-governmental organization founded by a family named Pew, P-E-W, in the late 1940s, and what they wanted to do was to affect public policy in 2 primary areas, healthcare and the arts. And you may know the Pew name if you listen to NPR. We're a major sponsor of National Public Radio. If you've ever watched a Ken Burns documentary, they're primarily funded by Pew, the Pew Charitable Trust. And on the environment and healthcare side, they've developed these organizations to lobby Congress and FDA. So there's a bill before Congress called the Preservation of Antibiotics for Medical Treatment Act, or PAMTA. One California Senator, Dianne Feinstein, is the Senate sponsor, the lead in the Senate. And we've run into fairly serious resistance in Congress because of the industrial ag sector. They're a very powerful, very well-funded segment, and we've actually run into some resistance at FDA. FDA could regulatorily reduce the amount of antibiotics used. We first learned of a problem with antibiotic resistance because of food animal use in about 1978. FDA has declined to take action over the last 33 years. Mainly because the Center for Veterinary Medicine at FDA, that is in charge of regulating antibiotics in animal feed, is very closely tied to the industry and to the American Veterinary Medical Association, as well as land-grant colleges are not the best at promoting sustainable agriculture. So we've been working to convince FDA to reduce the amount of antibiotics used. They've announced a preliminary rule called Guidance 209 that we hope when the final rule is released late this year will actually reduce the amount used. And I want to stress too that if you don't eat meat, this inappropriate use in food animals still affects you, because the way most industrial vegetable production systems are fertilized in the country is through effluent from industrial animal productions. The big E. coli outbreak on spinach last year that was resistant to antibiotics E. coli is a bacteria that's found in animal intestinal tracts. People have E. coli, a version of E. coli in them. But what was found that tainted the spinach that was making people sick was livestock or cattle E. coli. And it was found that many of the large lettuce and spinach operations in the country are using runoff or waste from dairy operations and industrial cattle operations to fertilize their crops. So the real concern, WHO has said, the World Health Organization has said, we're facing an era of post-antibiotic medicine. The CDC has said the same thing. And if 80% of the antibiotics are used in the country to keep food animals healthy in filthy, environmentally unsound operations, I think that's where we need to look to reduce usage. So with that, I hope I've answered the first part of the question.
Yeah,
Okay.
fascinating. We're going to move on, and then we'll come back around if we have time to follow up. And thank you very much, Bob. It's wonderful. I also want to let you know, all you speakers, thank you. We are having a simultaneous Spanish translation, so the cadence, Bob, is perfect. If we have any rapid speakers that you want to talk a little faster, maybe we can just keep mindful. She's doing a great job. Are we doing okay? Speed-wise? Okay, great. Fantastic. So, Andrea, go ahead and give us a talk about what your work with Kaiser. Thank you.
Sure. So just a little bit of background. Kaiser Permanente is America's largest non-for-profit health plan, and we're both an integrated health plan, hospital system, and medical group. And our mission is to provide affordable, high-quality healthcare service to improve the health of our members and the communities we serve. And we have a pretty large reach. In Southern California, we have 3.4 million members. We're the largest private employer in LA County with over 60,000 employees and physicians. We have 13 hospitals and 150 medical offices. So as a prevention-oriented organization, we strive to have this reflect in our own internal operations, and we really see that we have a huge opportunity because we reach so many people on a daily basis. Of course, in this audience, nobody here is surprised about the obesity epidemic. I'm sure you're all well familiar with it, and Supervisor Yaroslavsky gave us a good overview of the linkage between obesity and health concerns like type 2 diabetes, hypertension, heart disease, and depression. So we definitely have a stake in this as a healthcare organization. And I want to just talk a little bit to start with about some of our own internal initiatives that we have in trying to make our facilities a healthy place for our employees and physicians and members. And these are areas that intersect with the good food movement. We've created 15 farmers markets in our own hospitals and medical centers in Southern California. So these are regular ongoing markets. Most of them are weekly that provide food access. And across the country, we have 40 markets in 6 states in the District of Columbia. We've eliminated sugar-sweetened beverages from 30 of our regional offices and 3 of our hospitals. So where we've taken out sodas and other sweetened beverages, we've increased our offerings of juices and sugar-free drinks and sparkling waters. And while we've made some progress, we have more to do, and we've kind of made a lofty goal of expanding this initiative to all of our facilities by the end of the year. So we know that sugar-sweetened beverages are a contributor to the obesity epidemic, and so we're looking for ways to present healthier beverage alternatives in our own facilities. We're purchasing local food. In our cafeterias and our patient meals, we're trying to procure more local produce. As of last year, we were at about, I think, 8% of our produce purchases were from local sources, and we have a goal of increasing that percentage, and we're trying to build that into our contracts with our suppliers. And we're also doing things like, to kind of piggyback what Bob was talking about, trying to purchase more milk that's free of RBST and more meat products that are free of hormones. And then, I guess, a couple more things. We have a Healthy Picks program that includes healthy items in our vending machines. So instead of just candy bars and sugary, high-fat snacks, that we're trying to really make healthy choices available in those venues. And we're happy to serve on the LA Food Policy Council and have a seat at that table where we can connect and collaborate and catalyze with other partners across the county and be involved in national venues like Healthcare Without Harm. So in all these initiatives, we're really trying to be a part of the good food movement and look for ways that we can make the healthy choice the easy choice for our members and our employees and our physicians.
Thank you so much, Andrea. It's great to hear, and seeing the Kaisers going up and seeing those markets is really a terrific model for all of us. Ken Kaplan, please go ahead and talk more about your work at MIT and tell us how that all fits into the good food movement. Thank you.
Absolutely. Again, thank you for Laura and Jim for having me here. I'm at MIT. I'm actually with the engineering school right now. I formed a group at MIT called Collaborative Initiative, which is bringing people together to look at very complex types of social, cultural problems in our society. And the first initiative was called New Models for Health. I'm actually trained as an architect. I spent 12 years as a psychiatric social worker. I was in the community and working on behavioral issues, but I combined my architectural training to what we call as a systems perspective on these kinds of complex problems, health, environment, the economy. The childhood obesity study applied that approach. It was actually a collaboration with Columbia University, the Earth Institute, where we looked at this very, as you're all aware, disturbing and alarming problem, trying to understand not a single cause, but the multiple causes. What came out of that study was a 2.5-year, 3-year study with United Health Foundation in Minneapolis. We looked at all the projects going on in the country, most of them, and looked at the study. But the piece that was the least understood was, and everyone came back to, it was just not a lot of research, not knowledge, just a little bit. Bob Martin was an advisor to the project, was the food system. And we spent another year looking at the food system to try to understand how we get these two food and health systems, two big industries to work together. Let me get to my question.
Oh, good. Great.
Let me get to the rub of this. We are not going to change the health system unless we change the food system. It's not going to happen. I've been in healthcare for many years, and I'm not saying food is the only source of I see the change, but it's also exercise. I think your supervisor was very articulate about what we need to do. But the complexity of food is also the economy. Right now, as you know, the country is in a crisis. The world is in a crisis. It's an economic crisis. And one of the drivers to that crisis is the rising cost of healthcare. And it's all across a number of illnesses that have been around for years, but weren't around 30, 40 years ago. All of a sudden emerged, you look at the data, particularly in this country after World War II, you see a rising problem in chronic diseases. And I think that and I know too much about the healthcare system to tell you that there is not within that system right now the tools to change it if you use traditional medicine. And I think the exciting thing about the food movement, which I've learned very recently, I mean, this champion thing that I'm now on is only like 3 years ago when I realized, and I got inspired by the good food movement, which I see as the cutting edge of the future of healthcare in our country. Because without the good food movement, they're the only, as I understand, and I learned a lot from Bob, the broken food system, and also the aging farmer population, the quality of the soil, all those, the lack of water. I mean, everything it takes to grow this piece of vegetable is actually diminishing in terms of the quality of food. And the direct relationship between quality of food and your physical health is there. And we've known about it for centuries. It's actually in the great wisdom of good cultures, as well as in the research. So I think that when I say, but here's the good news. We are in an economic crisis. Healthcare is all about borrowing money right now. There's no money to pay for our healthcare. We're going to have to find cheaper, lower cost ways to cure 80% of the healthcare budget. And I see food, healthy food, and Whole Foods is in the lead on this. I mean, it can't be just, unfortunately, just farmers markets. It has to be an industry scale kind of movement that brings the food and makes it accessible for it and teaches people how to do it and show them what to do with it, because that's part of it. But I think crisis brings change. And right now, I've been in discussion with the leadership in Washington, including the military health system, which I'm advising to. I'm also talking to the head of the Center of Medicare and Medicaid. The model is going to have to change. Congress needs a way to save money on health care. And I think you're going to see in the next 3 or 4 years major changes coming out of the industry, corporations pushing this drive. And it's not because they want you to be healthier, it's just they want to save money. Thank you.
Thank you very much. Thanks so much. It's good, like you say, I love the idea of you working with these complex, problems and then working and finding a solution where we may not be looking for it. And like you say, attacking the healthcare industry head on. Maybe not the most effective way, maybe create an alternative and then come back at it a different way. After we've moved something a little bit off center, because it seems like it's very stuck right now. We're going to change that. So, Nona Evans, please tell us more about Whole Kids Foundation.
Laura, thanks so much. You couldn't have set me up any better. So, thank you for that. I like to shake things up, and I can tell that you may have had a cup of coffee this morning, so we're going to do a little bit of survey. How many of you guys know about Whole Foods? Show of hands. All right. So, of those of you who know about Whole Foods, how many of you think of it first as a store? That's my job. So the irony here is that I spent 10 years building the Whole Foods Market store brand. And today I sit before you with a new job, which is to unbrand Whole Foods. So the Whole Kids Foundation is a new foundation, and we are part of the Whole Foods Market family. So I say that with all the love and respect that you can imagine. Our mission is to support schools and inspire families to improve children's nutrition. What I want you to walk out of here today knowing is that Whole Foods are foods that are closest to their form in nature. Whole Foods is not a store. Whole Foods is an idea and a path to health. And you're absolutely right. What we're out doing is finding ways to support teachers and inspire families to understand a very, very simple mathematical formula. And that is that food equals health. It's very, very well known, and you guys could speak so much better than I can to the scientific proof, but Mother Nature has provided us with an amazing rainbow of food in this world, and every single color in that rainbow contains micronutrients. Those micronutrients can provide our bodies with absolutely everything we need to be of optimal health. So it couldn't have been more perfect, the introduction we had today. So that's what we're working to do. We're working to inspire people to improve their nutrition with some simple choices. Choose vegetables first. We know we're going to get hungry every single day. Shouldn't be a surprise. If you can, every time it's possible, choose vegetables first, you will improve your health. When you choose what you eat, choose color. You know, we heard earlier about the idea of eliminating white from your diet. It's a very simple thing to do. You will realize better health if you make that very simple step. It may not be that you can eliminate white. Make it a point to choose more color in your foods. Choose whole grains. It's a very simple step. And then as you can, really work to eliminate or reduce processed and refined foods in your diets. So that is the work of the Whole Kids Foundation. We're working to educate and support our schools and inspire our families and children to improve children's nutrition. Really, it's a simple choice. I heard a wonderful organization that is dedicated to family elder care speak the other day. And, you know, I talk to kids all the time, and I say, you know, how many years of your life do you want to be able to go to the bathroom by yourself? It's a wake-up question. It's quite a startling thing. But that's the decision we make every time we choose what we eat. How long do I want to have optimal health? I don't know about you guys, but I would so much rather be able to spend the money I earn to travel to wonderful places like this than to have to spend those dollars in the healthcare system. So I challenge you all and honor you for your commitment in being here and being committed in this topic today.
Thank you so much. How many of you have seen the Whole Foods parking lot video? Everybody's seen that. That's really changed the brand of Whole Foods. My grandsons, my 3-year-old, that's all they want to learn. They know all about it. Okay, Mud Barron. Mud is he's the gardener for the Los Angeles, farmer for the Los Angeles School District. And Mud, please tell us more about what you're doing down there at San Pedro.
Yeah, thank you for having me, and Jim. Santa Monica College. If you're wondering where it happened to Superintendent Deasy, he didn't grow a goatee and start carrying around pooters. I'm filling in for the school district superintendent as and Laura didn't get to this point, I'm the former policy director for the school board. I do suit up, I wore other versions of gray flannel. But at the heart and the end of the day of what I do, and I'm so happy to see some of them here, is I support inspired teachers to give kids better food. End of conversation. That's 10 miles of inspiration. I don't have, unlike you, I hope you're good at the morning, to sit through endless panels. I'm working off of the general script that and if you guys finish this for me, okay, Uni? Okay, CCAP? Kids that grow veggies, eat veggies. Kids that cook veggies, eat veggies. And that's it. It's that simple. We don't need more policy papers. We don't need more pilot studies. We know this. We know this. So, my ADD-ness, tells me, all right, so get these inspired teachers like Carrie Ike from Uni High School. Stand up, Carrie. We haven't had a standing round of applause. Stand up, Mr. Cutler from CCAP. Stand up. Work we need to support if we're serious about executing these great ideas that we have here. And how we execute those ideas, my own take, because I was fired as the policy director for the school board when Jamie Oliver came to town and I handed him keys to the school district. Because I knew my boss was going to be taking on Oprah, Charlie Rose, Jon Stewart, and the Wall Street Journal, and I said, if you want to look like an asshole, you're welcome to. I'm not going to participate in that conversation. Because teachers like Carrie and teachers like Mitzi, who do amazing things with kids, need support. Now what that support is for me, since I was given a little bit of extra time on my hands, and if you follow me at all, any of you follow me on Twitter as Kokazochi? Hands?
We'll spell that later.
Yeah, it's the Aztec word for you will say inappropriate comments at public policy panels to get personally to kids.
Tourette's syndrome.
It's you speak truth to power, and sometimes the power in the forms of Superintendent Deasy and the rest, they have $500 million in choices they make every year. They don't include good food choices. I don't have to speak to their priorities, they're not here. I am, as the farmer in San Pedro with the pruners and the plug trays. And the work that we do every day in San Pedro, which is a 4-acre site, you're all welcome to come. Saturday evening, I'm there cutting flowers for the Hollywood Farmers Market with my kids and my volunteers. This year, we'll facilitate over $10 million in in-kind donations to school gardens in LA County, Chicago, New Orleans, New York. I'm a brand ambassador for Seeds of Change. When you're a policy director, you can't take corporate checks from the largest organic heirloom seed company. Well, Liberation gives you an opportunity to engage as a social entrepreneur to make it possible for angels, whether it's the Whole Foods Foundation, mad props, $2 million in school garden grants this year. Mad props to us. And I'm working hard right now to get Kaiser and Pew to do equal likewise. $10 million in seeds and plants means every school in LA County, and Carrie, tell me if I'm wrong, Mitzi, tell me if I'm wrong, there's not a single one of them that has to pay for seeds or plants. It's a start. That's actual real policy. They can't use a policy paper out of the MacArthur Institute. It's not going to get the job done. You literally, social justice looks a lot more like a Home Depot garden section than it does, I adore her, but Alice, your boutique projects aren't going to cover, and your numbers were wrong, 700,000 kids in LA County, in LA Unified Schools, and another 700,000 in the county as a whole.
You gave me that.
Yeah, it's well, I'm not going to the ADD one on this one. So there's 1.5 million kids in LA County, and the work of what I want to see done, and what I'm challenging you all to do, is make it an opportunity for every one of them to grow parsley, making an opportunity for every one of them to be on a first name basis with a butterfly. I know that's hippie stuff, but you know what? At heart, I'm an environmental educator, and kids, Michael Pollan, his script, our most intimate relationship with the environment is the food we take. LUSD has 5,000 acres of asphalt. The daily relationship that the kids have with the environment is asphalt and chain link. The wackadoodle menu that LUSD put out this year looks good on paper. It probably tastes better than the hummus that I tried yesterday. It was, as my grandma would say, the hummus at El Unified is shit. Kids deserve the opportunity for the work where CCAP and teachers like Carrie come in. And I'm going to challenge the donor community. We're in the West Side. I've spent more time in the West Side in the last 2 days than I've had in the past year. I'm in San Pedro. I live in the valley. $10 million will create 100 one-acre farms in LA at the schools. The school district has $500 million in sustainability. A donor gives me $1 million, I will turn that into half. The last thing I'll say, as I spoke with the chief of staff of board member Vladovic, his former chief of staff, he signed up. He wants the first one-acre farm. There's another 99 teachers that'll take the one-acre farm. The other conversation was with board member Kaiser, who was delighted that I'm here representing him, because he thinks $1.95 per year per student for a science budget is inappropriate, and we could do far better. In the wealthiest country in the world, we could do far better. And as a farmer, the lesson I'll leave you with is that we grow abundance. So let's show the kids.
Delay, that's the problem. So we're just closing up here on time. I want to thank everybody here who was on the panel. You will be around. The conversation will continue out on the quad. We're going to have food trucks for lunch. And please catch up with these wonderful panelists and continue the discussion. They're all, contact information is available in the programs. And thank you all very, very, very much for being here today and for sharing your wisdom with us. It's very inspiring. Thanks so much.